Phlebotomy study with me. Question 1. Which of the following items is classified as a biohazard and must be disposed of in a rigid sharps container? Option A clean, unused plastic tube holder. Option B, a blood-soaked gauze pad. Option C, a used lancet device from a heel stick. Option D, the paper backing from an adhesive bandage. The correct answer is option C, a used lancet device from a heel stick. A used lancet is a contaminated sharp and must be placed in a rigid sharps container. Sharps disposal prevents puncture injury and bloodborne pathogen exposure. Gauze may be biohazardous if saturated, but it does not belong in a sharps container unless it contains a sharp. Question 2. What is the clinical term for blood that has escaped from a vessel into the surrounding tissue layers? Option A, petechiae. Option B, hematoma. Option C, thrombus. Option D, hemostasis. The correct answer is option B, hematoma. A hematoma is blood that has leaked from a vessel into surrounding tissue. It may appear as swelling, bruising, or tenderness at the puncture site. Petechiae are pinpoint hemorrhages, while a thrombus is a clot inside a vessel. Question 3. If a phlebotomist notes that a patient has an active hematoma in the right antecubital area, where should they draw blood? Option A, distal to, below, the hematoma in the right arm, or use the left arm. Option B, directly through the center of the active hematoma swelling. Option C, proximal to, above, the hematoma on the upper right arm. Option D, from the foot on the same side as the hematoma. The correct answer is option A, distal to, below, the hematoma in the right arm, or use the left arm. An active hematoma contains pooled blood outside the vessel and should not be punctured. The opposite arm is preferred, or a site distal to the hematoma may be used if appropriate and permitted. Drawing through the swelling can contaminate the sample and worsen bruising. Question 4. What type of fire hazard is represented by the red quadrant of the NFPA 704 diamond? Option A, flammability hazard. Option B, health hazard. Option C, reactivity hazard. Option D, specific hazard. The correct answer is option A, flammability hazard. The red quadrant of the NFPA 704 diamond indicates flammability hazard. It communicates how readily a material can ignite. Blue represents health, yellow represents instability, and white indicates special hazard information. Question 5. What does a trough level measure in therapeutic drug monitoring, TDM? Option A, the highest concentration of the drug in the patient's system. Option B, the lowest concentration of the drug, measured right before the next dose. Option C, the average concentration of the drug over a 24-hour window. Option D, the amount of drug excreted through the kidneys. The correct answer is option B, the lowest concentration of the drug, measured right before the next dose. A trough level measures the lowest drug concentration, usually just before the next scheduled dose. Timing is critical because the result guides dosing safety and therapeutic effectiveness. Peak levels measure the highest concentration after dosing and answer a different clinical question. Question 6. For which of the following tests must a phlebotomist use a gray top tube containing potassium oxalate? Option A, erythrocyte sedimentation rate, ESR. Option B, oral glucose tolerance test, OGTT. Option C, activated partial thromboplastin time, APTT. Option D, blood urea nitrogen, BUN. The correct answer is option B, oral glucose tolerance test, OGTT. Oral glucose tolerance testing uses gray tubes when glucose stability must be preserved over time. Sodium fluoride slows glycolysis, while potassium oxalate helps prevent clotting. Coagulation, chemistry, and hematology tubes do not provide the same glucose preservation. Question 7. What should a phlebotomist do if they accidentally puncture an artery during an attempted venipuncture? Option A, complete the draw quickly and label the tube as venous blood. Option B, remove the needle immediately, apply firm, direct pressure to the site for at least 5 minutes, and notify nursing staff. Option C, leave the tourniquet tied tight to prevent a hematoma from forming. Option D, instruct the patient to bend their arm firmly over a gauze pad. The correct answer is option B, Remove the needle immediately, apply firm, direct pressure to the site for at least 5 minutes, and notify nursing staff. An arterial puncture during venipuncture requires immediate needle removal and firm direct pressure for an extended period. Nursing staff or the provider should be notified because arterial bleeding can form a significant hematoma. Continuing the draw or applying light pressure is unsafe. Question 8. Which of the following situations requires a phlebotomist to follow airborne precaution protocols? Option A. Collecting blood from a patient with a suspected MRSA skin infection. Option B. Drawing samples from a patient diagnosed with measles or active varicella. Option C. Performing venipuncture on a patient with seasonal rhinovirus. Option D. Collecting a lipid panel from a patient with hepatitis C. The correct answer is option B. Drawing samples from a patient diagnosed with measles or active varicella. Measles and active varicella spread by airborne particles and require airborne precautions. This includes an appropriate respirator and a negative pressure room when available. MRSA skin infections usually require contact precautions, and hepatitis C follows blood-borne standard precautions. Question 9. What is the primary function of the anticoagulant EDTA? Option A. It enhances the action of thrombin. Option B. It binds calcium ions, preventing the clotting cascade from activating. Option C. It destroys white blood cells to preserve red cells. Option D. It stabilizes glucose levels by stopping cellular glycolysis. The correct answer is option B. It binds calcium ions, preventing the clotting cascade from activating. EDTA binds calcium ions and prevents the coagulation cascade from progressing. This preserves whole blood for hematology testing and maintains cell morphology. It does not preserve glucose or accelerate clotting. Question 10. Which of the following variables can cause a specimen to appear cloudy or milky white after centrifugation? Option A. High levels of lipids, fats, circulating in the blood. Option B. Extensive hemolysis from using a small needle. Option C. Elevated levels of direct and indirect bilirubin. Option D. Failure to mix an anticoagulant tube after drawing. The correct answer is option A. High levels of lipids, fats, circulating in the blood. High circulating lipid content produces a cloudy or milky serum or plasma appearance after centrifugation. This condition is called lipemia and may interfere with optical laboratory methods. Hemolysis creates red discoloration, while icterus creates yellow discoloration. Question 11. What clinical term describes a hard, cord-like vein that has become occluded or blocked due to repeated inflammation or chemical irritation? Option A. Sclerosed or thrombosed vein. Option B. Patent vein. Option C. Tortuous vein. Option D. Superficial vein. The correct answer is option A. Sclerosed or thrombosed vein. A sclerosed or thrombosed vein feels hard, cord-like, and may be partially or fully blocked. Repeated puncture, inflammation, or irritating infusions can produce this condition. Such veins should generally be avoided because flow is poor and injury risk is higher. Question 12. What type of consent is demonstrated when an adult outpatient rolls up their sleeve and extends their arm toward the phlebotomist after being asked for a blood draw? Option A. Expressed consent. Option B. Informed consent. Option C. Implied consent. Option D. Statutory consent. The correct answer is option C. Implied consent. Rolling up a sleeve and extending the arm after being asked to provide a specimen demonstrates implied consent. The patient's actions show cooperation with a routine procedure. Signed informed consent is a more formal process used when required by policy or procedure risk. Question 13. Why should a phlebotomist avoid drawing blood from a paralyzed arm? Option A. The veins are too large and prone to exploding. Option B. The lack of muscle movement leads to poor circulation and potential thrombosis. Option C. The patient cannot feel if a nerve is being struck by the needle. Option D. Paralyzed limbs do not contain white blood cells. The correct answer is option B. The lack of muscle movement leads to poor circulation and potential thrombosis. A paralyzed arm may have reduced circulation, impaired sensation, and increased risk of thrombosis or swelling. Specimens from that limb may not reflect normal circulating blood as reliably. Lack of pain sensation can also delay recognition of injury, but poor circulation is the main concern. Question 14. What clinical condition is characterized by fluid accumulation in the intercellular tissue spaces, making the arm swollen? Option A, lymphedema or edema. Option B, petechiae. Option C, sclerosis. Option D, hematoma. The correct answer is option A, lymphedema or edema. Lymphedema or edema describes swelling from fluid accumulation in intercellular tissue spaces. It may occur after lymph node removal, obstruction, injury, or other circulation problems. Drawing from a swollen limb can be difficult and may produce unreliable specimens. Question 15. Which of the following options defines the proper site for performing a venipuncture on a patient's hand? Option A, the ventral aspect of the wrist near the radial artery. Option B, the dorsal aspect of the hand, focusing on the dorsal venous network. Option C, the inside aspect of the thumb pathway. Option D, the lateral borders of the palm. The correct answer is option B, the dorsal aspect of the hand, focusing on the dorsal venous network. Hand venipuncture is performed on the dorsal venous network on the back of the hand. These veins are superficial and require careful anchoring and a shallow angle. The palm, wrist, or underside of the hand carries more risk and is not preferred. Question 16. Which of the following statements matches the correct definition of assault? Option A, unjustified or unconsented physical contact with another person. Option B, the intentional threat or attempt to cause bodily harm, creating fear in the patient. Option C, revealing confidential medical findings to unauthorized personnel. Option D, mislabeling a laboratory specimen tube by accident. The correct answer is option B, the intentional threat or attempt to cause bodily harm, creating fear in the patient. Assault is an intentional threat or attempt that makes a patient fear harmful contact. No physical touching is required for assault to occur. Battery involves unauthorized touching, and confidentiality breaches involve private information rather than threatened harm. Question 17. What should a phlebotomist do if they encounter an aggressive, uncooperative psychiatric patient accompanied by an order for blood work? Option A, enlist colleagues to restrain the patient by force without nursing guidance. Option B, postpone the draw and consult with the nurse in charge of the patient's care. Option C, attempt to draw blood while the patient is asleep. Option D, cancel the test order permanently on your own authority. The correct answer is option B, postpone the draw and consult with the nurse in charge of the patient's care. An aggressive or uncooperative psychiatric patient requires a safety-focused pause and coordination with nursing staff. The care team can determine whether the draw should be delayed, supported, or handled under a specific behavioral plan. Drawing while the patient sleeps or using force without guidance creates serious safety and legal risks. Question 18. Which of the following elements is a key component of quality control in a point-of-care testing (POCT) program? Option A, documenting the daily temperature of the laboratory refrigerator. Option B, verifying that the patient's insurance information is updated. Option C, running electronic or liquid controls according to manufacturer and facility guidelines. Option D, cleaning the outpatient waiting room chairs with bleach solution. The correct answer is option C, running electronic or liquid controls according to manufacturer and facility guidelines. POCT quality control includes running electronic or liquid controls according to manufacturer instructions and facility policy. Controls verify that the device, reagents, and operator process are producing reliable results. Patient testing without required QC can lead to inaccurate bedside decisions. Question 19. What is the standard gauge size of a needle used for routine adult venipuncture in most clinical settings? Option A, 18 gauge. Option B, 21 gauge. Option C, 25 gauge. Option D, 16 gauge. The correct answer is option B, 21 gauge. A 21 gauge needle is commonly used for routine adult venipuncture because it balances adequate flow with acceptable patient comfort. It is large enough to reduce hemolysis risk in normal veins. Smaller gauges may be used for fragile or small veins, but they are not the routine default. Question 20. Which of the following additives works by chelating or binding calcium to inhibit the coagulation cascade? Option A, lithium heparin. Option B, ethylenediamine tetracetic acid, EDTA. Option C, sodium fluoride. Option D, ammonium oxalate. The correct answer is option B, ethylenediamine tetracetic acid, EDTA. EDTA chelates calcium, removing a key requirement for activation of the coagulation cascade. This prevents clot formation and preserves whole blood for hematology and selected molecular tests. Heparin prevents clotting through antithrombin rather than calcium chelation. Question 21. What type of isolation precautions must be followed when entering a room to draw blood from a patient with an active vancomycin-resistant enterococcus, VRE, infection? Option A, airborne precautions. Option B, droplet precautions. Option C, contact precautions. Option D, protective reverse isolation. The correct answer is option C, contact precautions. VRE is commonly spread by direct contact with contaminated hands, surfaces, or equipment. Contact precautions use gown, gloves, and dedicated equipment to reduce transmission. Airborne and droplet precautions are reserved for respiratory spread. Question 22. Which of the following tests requires a strict chain of custody tracking form to accompany the specimen through collection, processing, and analysis? Option A, basic metabolic panel, BMP. Option B, forensic drug analysis or paternity testing. Option C, therapeutic drug monitoring for digoxin. Option D, blood culture tracking for endocarditis. The correct answer is option B, forensic drug analysis or paternity testing. Forensic drug analysis and paternity testing require strict chain of custody tracking from collection through analysis. This documentation preserves legal defensibility and proves specimen integrity. Routine clinical tests generally use standard identification and accessioning procedures. Question 23. Which of the following additives is present in a light green top plasma separator tube, PSD? Option A, sodium heparin and a gel barrier. Option B, lithium heparin and a gel barrier. Option C, DDTA and a gel barrier. Option D, clot activator and a gel barrier. The correct answer is option B, lithium heparin and a gel barrier. Light green PSD tubes contain lithium heparin and a gel barrier. Lithium heparin prevents clotting, and the gel separates plasma from cells during centrifugation. SST tubes contain clot activator for serum rather than heparinized plasma. Question 24. What should a phlebotomist do if they observe small, red spots appearing on a patient's skin after applying a tourniquet? Option A, remove the tourniquet immediately, as this indicates petechiae and potential bleeding issues. Option B, tighten the tourniquet further to stop the spots from spreading. Option C, ignore the spots, as they are a normal reaction to isopropyl alcohol. Option D, rub the skin surface firmly to see if the spots disappear. The correct answer is option A, remove the tourniquet immediately, as this indicates petechiae and potential bleeding issues. Petechiae after tourniquet application suggest fragile capillaries or a bleeding tendency. The tourniquet should be removed and the site reassessed before proceeding. Continuing pressure can worsen capillary bleeding and bruising. Question 25. Which of the following steps is part of the proper protocol for performing a newborn screening? PKU. Collection. Option A, layering multiple drops of blood onto a single filter paper circle. Option B, touching the filter paper directly to the infant's Venipuncture site to absorb blood into the circles. Option C, using a capillary tube to collect blood and then smearing it across the card. Option D, wiping the filter paper card with isopropyl alcohol before applying blood. The correct answer is option B, touching the filter paper directly to the infant's Venipuncture site to absorb blood into the circles. Newborn screening cards should be filled by allowing blood to soak directly from the heel drop into the filter paper circles. The paper should not be pressed hard against the skin or layered repeatedly. Proper saturation through the paper is essential for valid screening. Question 26. Which of the following conditions can cause a specimen to be rejected due to hemolysis? Option A, using a needle with a large lumen, such as an 18-gauge needle. Option B, drawing blood through an active hematoma or pulling a syringe plunger back too forcefully. Option C, inverting a serum separator tube gently 5 times after collection. Option D, centrifuging a completely clotted serum tube for 10 minutes. The correct answer is option B, drawing blood through an active hematoma or pulling a syringe plunger back too forcefully. Drawing through a hematoma or pulling a syringe plunger too forcefully can rupture red blood cells. Hemolysis releases intracellular contents and may lead to specimen rejection or false chemistry results. Gentle inversion and proper clotting before centrifugation help protect specimen integrity. Question 27. What color top tube contains the additive thrombin, which acts as a rapid clot activator for stat serum determinations? Option A, orange top. Option B, light blue top. Option C, lavender top. Option D, gray top. The correct answer is option A, orange top. Orange top tubes contain thrombin, a rapid clot activator used for some stat serum determinations. Thrombin speeds clot formation so serum can be processed quickly. Anticoagulant tubes such as lavender, gray, and light blue are intended to prevent clotting rather than accelerate it. Question 28. Why is it essential to allow the 70% isopropyl alcohol to dry completely on the skin before puncturing? Option A, to prevent the alcohol from evaporating too fast. Option B, to avoid hemolysis of the specimen and a stinging sensation for the patient. Option C, to ensure the vein does not roll during insertion. Option D, to maximize the chemical interaction with the tube additive. The correct answer is option B, to avoid hemolysis of the specimen and a stinging sensation for the patient. Alcohol must dry completely so it can disinfect effectively and avoid being carried into the puncture site. Wet alcohol can sting and may contribute to hemolysis or specimen contamination. Blowing on or fanning the site can recontaminate the area and should be avoided. Question 29. What should a phlebotomist do if an outpatient becomes pale, sweaty, and complains of feeling dizzy before you insert the needle? Option A, proceed quickly with the puncture before they pass out completely. Option B, terminate the preparation, lower the patient's head or recline the chair, and provide a cool cloth or assistance. Option C, instruct the patient to take deep, rapid breaths to hyperventilate. Option D, give the patient a glass of hot water to drink immediately. The correct answer is option B, terminate the preparation, lower the patient's head or recline the chair, and provide a cool cloth or assistance. Pallor, sweating, and dizziness before needle insertion suggest an impending fainting episode. Preparation should stop, the patient should be reclined or assisted safely, and symptoms should be managed before any draw attempt. Continuing may lead to syncope, falls, or injury. Question 30. What color top tube contains the additive sodium citrate and is used for coagulation profiles? Option A, light blue top. Option B, lavender top. Option C, green top. Option D, gray top. The correct answer is option A, light blue top. Light blue tubes contain sodium citrate and are used for coagulation profiles. Citrate binds calcium reversibly and preserves clotting factors for testing when the tube is properly filled. Other tube colors contain additives that can interfere with coagulation assays. Question 31. Which analytical error is categorized as a pre-examination, pre-analytical error? Option A, miscalibrating a chemistry analyzer machine. Option B, misidentifying a patient before collecting their sample. Option C, misinterpreting a reading on a microscopic smear sheet. Option D, delays in transmitting finalized electronic reports to the doctor. The correct answer is option B, misidentifying a patient before collecting their sample. Misidentifying a patient before collection is a pre-examination error because it occurs before the specimen is analyzed. Pre-analytical errors often have the greatest impact on patient safety because the wrong sample can produce a believable but unsafe result. Analyzer calibration and report transmission belong to later phases. Question 32. What is the primary clinical reason for avoiding the basilic vein whenever possible? Option A, it is too small to yield an adequate sample. Option B, It is located near the brachial artery and median nerve. Option C. It has a high tendency to collapse under low pressure. Option D. It contains valves that prevent blood flow into the tube. The correct answer is option B. It is located near the brachial artery and median nerve. The basilic vein lies close to the brachial artery and median nerve on the medial side of the arm. Accidental injury in this area can cause severe bleeding, nerve pain, or other complications. It is used only when safer veins are unavailable and the practitioner is confident in the site. Question 33. What should a phlebotomist do if a patient begins to have a grand mal seizure during a venipuncture? Option A. Hold the needle steady inside the vein to complete the draw. Option B. Remove the needle and tourniquet immediately, safeguard the patient from injury, and call for medical help. Option C. Place a wooden tongue depressor inside the patient's mouth to protect their tongue. Option D. Restrain the patient's arms firmly against the drawer chair to stop all movement. The correct answer is option B. Remove the needle and tourniquet immediately, safeguard the patient from injury, and call for medical help. A seizure during venipuncture requires immediate removal of the needle and tourniquet to prevent injury. The patient should be protected from surrounding hazards and medical help should be called. Restraining the patient or placing objects in the mouth can cause harm. Question 34. Which of the following additives is found in a yellow top blood culture tube? Option A. Sodium polyant whole sulfonate, SPS. Option B. Acid citrate dextrose, ACD. Option C. Dethylenediamine tetracetic acid, EDTA. Option D. Sodium citrate. The correct answer is option A. Sodium polyant whole sulfonate, SPS. Yellow blood culture tubes contain SPS, which supports organism recovery by limiting complement and phagocytic activity. It also provides anticoagulation for the culture specimen. ACD yellow tubes are different and are used for cellular or genetic testing. Question 35. What does the term phlebotomy literally mean in Greek? Option A. To clear a blood clot. Option B. To measure blood cells. Option C. To cut into a vein. Option D. To study circulating fluids. The correct answer is option C. To cut into a vein. The word phlebotomy comes from roots meaning to cut into a vein. The term reflects the traditional act of opening a vein to obtain blood. Measuring cells, studying fluids, or removing clots describes different laboratory or clinical activities. Question 36. Which of the following factors can cause hemoconcentration during a blood collection procedure? Option A. Leaving the tourniquet tied on the arm for 3 minutes while searching for a vein. Option B. Releasing the tourniquet as soon as the first tube begins to fill with blood. Option C. Utilizing a needle with a large lumen, such as a 21-gauge needle. Option D. Having the patient remain in a supine position for 20 minutes before the draw. The correct answer is option A. Leaving the tourniquet tied on the arm for 3 minutes while searching for a vein. Leaving a tourniquet on for several minutes causes venous stasis and fluid shifts out of the vessel. This concentrates cells and analytes, producing hemoconcentration. The tourniquet should be released within the recommended time and reapplied only after an appropriate pause if needed. Question 37. Which of the following tests requires that the specimen be transported to the laboratory on an ice slurry immediately after collection? Option A. Lactic acid and ammonia. Option B. Cold agglutinins and cryoglobulins. Option C. Bilirubin and vitamin B6. Option D. Prothrombin. Patient. The correct answer is option A. Lactic acid and ammonia. Lactic acid and ammonia specimens are commonly transported on an ice slurry to slow cellular metabolism and chemical change. Rapid chilling helps preserve the concentration present at collection. Warm transport or light protection is required for different special tests. Question 38. What type of collection is performed to screen for hidden blood in a stool specimen? Option A. Occult blood test, GWAS. Option B. Culture and sensitivity, C&S. Option C. DOVA and parasites, ONP. Option D. Fecal fat quantification. The correct answer is option A. Occult blood test, GWAS. An occult blood test, often using a Guaric method, screens stool for hidden blood. It can help detect gastrointestinal bleeding that is not visible. Culture, over and parasite testing, and fecal fat analysis evaluate different stool conditions. Question 39. What should a phlebotomist do when a multisample vacuum tube fails to fill with blood during a draw? Option A. Gently advance or pull back the needle slightly to ensure it is in the lumen. Option B. Remove the needle completely and start over on the other arm. Option C. Leave the tube in place for 3 minutes to allow the vacuum to recover. Option D. Push the needle deeper at a 90-degree angle. The correct answer is option A. Gently advance or pull back the needle slightly to ensure it is in the lumen. A vacuum tube that fails to fill may indicate the needle bevel is against the vein wall or not fully in the lumen. A small adjustment forward or backward can restore flow without unnecessary reinsertion. Pushing deeply or waiting for the vacuum to recover can injure tissue and waste time. Question 40. What should a phlebotomist do if they encounter a patient who does not speak the same language as the healthcare provider? Option A. Use hand gestures to explain the invasive procedure and proceed with the draw. Option B. Enlist the services of a certified medical interpreter to ensure proper communication and consent. Option C. Ask the patient's roommate to translate the instructions for you. Option D. Cancel the test order and document the patient as uncooperative. The correct answer is option B. Enlist the services of a certified medical interpreter to ensure proper communication and consent. Certified medical interpreters ensure that the patient receives accurate information and can provide meaningful consent. Family members or untrained staff may omit, alter, or misunderstand medical details. Clear communication is essential for safety, cooperation, and legal compliance. Question 41. What color top tube is used to collect specimens for lead testing? Option A. Tan or royal blue with EDTA. Option B. Light blue. Option C. Light green. Option D. Yellow. The correct answer is option A. Tan or royal blue with EDTA. Lead testing requires tubes certified to be low in trace metal contamination, commonly tan or royal blue with EDTA. Ordinary stoppers and additives can contaminate trace element specimens. Light blue, green, and yellow tubes are selected for different testing needs. Question 42. Which of the following factors can cause a specimen to become hemolyzed during processing? Option A. Allowing a serum separator tube to clot completely before centrifugation. Option B. Balancing the centrifuge correctly with tubes of equal volume. Option C. Centrifuging a specimen before it has completely clotted or spinning at an excessively high RPM. Option D. Keeping a plasma specimen chilled on an ice slurry. The correct answer is option C. Centrifuging a specimen before it has completely clotted or spinning at an excessively high RPM. Centrifuging a specimen before it clots completely or spinning too aggressively can rupture cells. This processing-related hemolysis can make serum or plasma red and alter analytes. Proper clot time and centrifuge settings help prevent specimen damage. Question 43. Which of the following additives is used in a blood culture bottle to neutralize antibiotics circulating in the patient's blood? Option A. Resin or activated charcoal particles. Option B. Sodium polyant whole sulfonate, SPS. Option C. Acid citrate dextrose, ACD. Option D. Thixotropic gel barrier. The correct answer is option A. Resin or activated charcoal particles. Resin or activated charcoal in blood culture bottles can bind or neutralize antibiotics present in the patient's blood. This improves recovery of organisms when the patient has already received antimicrobial therapy. The additive does not replace sterile collection technique or proper bottle filling. Question 44. What is the function of the thixotropic gel inside an SST or PSD tube? Option A. To accelerate the coagulation cascade. Option B. To form a physical barrier between cells and serum/plasma during centrifugation. Option C. To preserve glucose levels for up to 24 hours. Option D. To chelate calcium and prevent fibrin formation. The correct answer is option B. To form a physical barrier between cells and serum/plasma during centrifugation. Thixotropic gel moves during centrifugation to create a stable barrier between the cells and the serum or plasma. This separation limits ongoing cellular metabolism and analyte exchange after spinning. The gel does not act as the anticoagulant or the clot activator. Question 45. Which additive acts as a glycolytic inhibitor in a gray top tube? Option A, sodium fluoride. Option B, lithium heparin. Option C, DDTA. Option D, thrombin. The correct answer is option A, sodium fluoride. Sodium fluoride inhibits glycolysis, slowing the breakdown of glucose by blood cells after collection. It is commonly paired with an anticoagulant in gray tubes for glucose-related testing. Heparin, EDTA, and thrombin serve different purposes and do not primarily preserve glucose. Question 46. Which of the following situations can lead to a charge of negligence against a phlebotomist? Option A, forgetting to sign your initials on a laboratory requisition sheet. Option B, leaving a tourniquet tied on a patient's arm for 5 minutes, resulting in permanent nerve injury. Option C, experiencing a minor specimen rejection due to an underfilled tube. Option D, utilizing a butterfly needle on an elderly patient's hand vein. The correct answer is option B, leaving a tourniquet tied on a patient's arm for 5 minutes, resulting in permanent nerve injury. Negligence occurs when a healthcare worker fails to meet the expected standard of care and the patient is harmed. Leaving a tourniquet on for 5 minutes can cause avoidable injury and inaccurate results. A poor outcome alone is not negligence unless duty, breach, harm, and causation are present. Question 47. What is the clinical name for the stoppage of bleeding from a damaged blood vessel? Option A, hemostasis. Option B, homeostasis. Option C, hemolysis. Option D, hemoconcentration. The correct answer is option A, hemostasis. Hemostasis is the process that stops bleeding after vessel injury. It involves vascular constriction, platelet plug formation, and coagulation. Homeostasis is broader internal balance, while hemolysis and hemoconcentration are specimen or blood changes. Question 48. What is the correct protocol for mixing an additive tube after filling? Option A, shake it vigorously up and down 5 times. Option B, roll it back and forth between your palms for 30 seconds. Option C, invert it gently back and forth the recommended number of times. Option D, let it sit completely still in a rack to mix naturally. The correct answer is option C, invert it gently back and forth the recommended number of times. Additive tubes must be mixed by gentle inversion the number of times recommended for that tube. This ensures blood contacts the additive without causing mechanical cell damage. Shaking, rolling, or leaving the tube unmixed can lead to hemolysis or clot formation. Question 49. How should a phlebotomist approach a child who needs a blood test? Option A, tell them it will not hurt at all to gain their trust. Option B, explain the procedure in simple, age-appropriate terms and ask for their cooperation. Option C, have 3 guards hold them down before introducing yourself. Option D, show them the largest needle to prove how brave they need to be. The correct answer is option B, explain the procedure in simple, age-appropriate terms and ask for their cooperation. Children cooperate best when the procedure is explained honestly in language they can understand. Asking for cooperation while using calm reassurance promotes trust and reduces fear. Saying it will not hurt or showing an intimidating needle can increase distress and loss of trust. Question 50. What is the main reason for avoiding blind probing or sweeping when attempting to locate a vein? Option A, it breaks the vacuum seal of the multisample tube. Option B, it can cause permanent damage to underlying nerves and blood vessels. Option C, it dulls the needle tip and makes skin entry painful. Option D, it causes the patient's blood pressure to spike excessively. The correct answer is option B, it can cause permanent damage to underlying nerves and blood vessels. Blind probing or sweeping moves the needle through tissue without knowing where the tip is. This can damage nerves, arteries, tendons, and surrounding soft tissue. If blood flow is not obtained with minor adjustment, the attempt should be stopped and reassessed. Question 51. Which of the following options defines the proper location for a dermal puncture on an infant's heel? Option A. The posterior curvature of the heel directly over the calcaneus bone. Option B. The medial or lateral margins of the plantar surface of the heel. Option C. The central arch area of the foot pad. Option D. The tips of the smaller toes. The correct answer is option B. The medial or lateral margins of the plantar surface of the heel. Infant heel punctures should be performed on the medial or lateral plantar margins of the heel. These sites reduce the chance of striking the calcaneus and provide suitable capillary blood. The arch, posterior heel, and toes are unsafe for routine newborn heel sticks. Question 52. When performing a dermal puncture on an infant's heel, what is the maximum allowable depth to prevent osteomyelitis? Option A 1.0 mm, option B 2.0 mm, option C 3.0 mm, option D 4.0 mm. The correct answer is option B, 2.0 mm. Newborn heel punctures must be shallow enough to avoid the calcaneus and deeper tissues. A maximum depth of 2.0 mm is used to reduce the risk of osteomyelitis and nerve or bone injury. Deeper lancets are unsafe for infants even if they appear to improve blood flow. Question 53. Which of the following parameters can cause a false elevation in a patient's serum bilirubin level? Option A. Exposing the specimen tube to direct room light or sunlight for an hour. Option B. Ensuring the specimen is kept away from light by wrapping it in foil. Option C. Centrifuging the specimen within 30 minutes of collection. Option D. Collecting the sample from a fasting patient. The correct answer is option D. Collecting the sample from a fasting patient. Fasting can increase serum bilirubin in some patients by altering bilirubin metabolism and hepatic handling. Light exposure usually lowers bilirubin by photodegradation, so it would not cause a false elevation. Proper bilirubin handling includes following preparation instructions and protecting the specimen from light. Question 54. What is the clinical name for the thin, white layer of cells that forms between the plasma and red blood cells when an anticoagulated blood sample is centrifuged? Option A. Serum layer. Option B. Buffy coat. Option C. Fibrin web. Option D. Thrombotome. The correct answer is option B. Buffy coat. The buffy coat is the thin whitish layer between plasma and red cells after centrifuging anticoagulated blood. It contains leukocytes and platelets. Serum, fibrin, and clot material are associated with different specimen states. Question 55. Which of the following tubes contains the anticoagulant lithium heparin? Option A. Light green top, PSD. Option B. Dark blue top. Option C. Yellow top. Option D. Gray top. The correct answer is option A. Light green top, PSD. Light green plasma separator tubes commonly contain lithium heparin and a gel barrier for chemistry testing. Heparin prevents clotting so plasma can be separated quickly after centrifugation. Other tube colors are used for trace metals, cultures, glucose preservation, or coagulation testing. Question 56. Which of the following additives is found in a green top tube and works by inhibiting the action of thrombin in the clotting process? Option A. Sodium citrate. Option B. DDTA. Option C. Heparin, lithium, ammonium, or sodium. Option D. Potassium oxalate. The correct answer is option C. Heparin, lithium, ammonium, or sodium. Green top tubes contain heparin, which prevents clotting by enhancing antithrombin activity and inhibiting thrombin. Lithium, sodium, and ammonium heparin are selected based on test requirements. Citrate, EDTA, and oxalate prevent clotting by binding or precipitating calcium. Question 57. What type of transmission occurs when an infectious agent is spread through contaminated food, water, or drugs? Option A. Vehicle-borne transmission. Option B. Vector-borne transmission. Option C. Airborne transmission. Option D. Direct contact transmission. The correct answer is option A. Vehicle-borne transmission. Vehicle-borne transmission occurs through contaminated food, water, drugs, or other shared substances. The infectious agent is carried by a non-living medium to the host. Vector-borne transmission involves living carriers such as mosquitoes or ticks. Question 58. What is the primary clinical consequence of warming an infant's heel prior to a dermal puncture? Option A. It decreases the pain perception of the infant. Option B. It increases localized arterial blood flow up to 7-fold. Option C. It sterilizes the deeper layers of the epidermis. Option D. It prevents the formation of an unneeded hematoma. The correct answer is option B. It increases localized arterial blood flow up to 7-fold. Warming an infant's heel increases local blood flow and improves capillary specimen collection. Better perfusion can reduce squeezing, which helps avoid tissue fluid contamination. Warming does not sterilize tissue or eliminate the need for proper puncture depth. Question 59. What is the primary purpose of the Joint Commission's National Patient Safety Goals, NPSG, in phlebotomy? Option A. To reduce the cost of laboratory testing instruments. Option B. To improve the accuracy of patient identification and eliminate diagnostic errors. Option C. To mandate the exact number of draws a phlebotomist must perform per hour. Option D. To regulate the salaries of medical laboratory technicians. The correct answer is option B. To improve the accuracy of patient identification and eliminate diagnostic errors. The National Patient Safety Goals emphasize accurate patient identification to reduce diagnostic and treatment errors. In phlebotomy, this directly affects bedside identification, specimen labeling, and matching the order to the patient. The goals are not designed to set draw quotas or regulate laboratory salaries. Question 60. Which of the following elements must be matched precisely between a patient's requisition sheet and their wristband? Option A. Patient's first name, last name, and unique medical record number. Option B. Patient's room number and name of their primary insurance carrier. Option C. Name of the ordering physician and the date the patient was admitted. Option D. Patient's diagnosis code and home phone number. The correct answer is option A. Patient's first name, last name, and unique medical record number. The requisition and wristband must match the patient's name and unique medical record number or equivalent identifier. Matching these identifiers confirms that the order belongs to the patient being drawn. Insurance, diagnosis, and physician information do not establish patient identity at the bedside. Question 61. What type of hazard is represented by the yellow quadrant of the NFPA 704 diamond? Option A. Health hazard. Option B. Flammability hazard. Option C. Instability or reactivity hazard. Option D. Specific or special hazard. The correct answer is option C. Instability or reactivity hazard. The yellow quadrant of the NFPA 704 diamond represents instability or reactivity. It warns how readily a material may react, decompose, or explode under certain conditions. Health, flammability, and special hazards are shown in the other quadrants. Question 62. Which of the following actions is a violation of proper sharp disposal safety guidelines? Option A. Dropping a needle into the sharps box immediately after withdrawal. Option B. Pushing down on items inside a full sharps container to make extra room. Option C. Disposing of a sharps box when it reaches the indicated full fill line. Option D. Placing the sharps container at eye level near the point of use. The correct answer is option B. Pushing down on items inside a full sharps container to make extra room. Pressing down on a full sharps container can cause puncture injury and aerosol exposure. Sharps containers should be replaced when they reach the marked fill line. They should be located near the point of use and never overfilled or manually compacted. Question 63. What type of consent is assumed when an emergency department patient is unconscious and requires immediate life-saving laboratory work? Option A. Expressed consent. Option B. Informed consent. Option C. Implied consent. Option D. Verbal consent. The correct answer is option C. Implied consent. Emergency implied consent applies when an unconscious patient needs immediate life-saving care and cannot provide permission. Necessary laboratory work may proceed under facility policy to support urgent treatment. This differs from routine outpatient cooperation or signed informed consent. Question 64. Which gauge needle has the smallest lumen diameter? Option A 18 gauge. Option B 21 gauge. Option C 23 gauge. Option D 25 gauge. The correct answer is option D, 25 gauge. Needle gauge is inversely related to lumen size, so higher gauge numbers have smaller openings. A 25 gauge needle has the narrowest lumen among the listed sizes. Smaller lumens can increase hemolysis risk when used for routine venipuncture. Question 65. What should a phlebotomist do if a patient experiences a sudden, sharp, shooting pain down their arm during a venipuncture? Option A, advance the needle deeper to see if the pain stops. Option B, terminate the venipuncture immediately, withdraw the needle, and assess for nerve injury. Option C, tell the patient that minor discomfort is completely normal for this vein. Option D, instruct the patient to keep their arm completely still while you finish filling the tube. The correct answer is option B, terminate the venipuncture immediately, withdraw the needle, and assess for nerve injury. Sudden sharp shooting pain down the arm suggests possible nerve contact. The venipuncture should be terminated immediately, the needle withdrawn, and the patient assessed according to policy. Continuing or redirecting the needle can worsen nerve injury. Question 66. Which of the following practices is an example of an engineering control to prevent blood-borne pathogen exposure? Option A, wearing a face shield when opening specimen tubes. Option B, utilizing a sharps container with a wide, drop-in opening and safety needle shields. Option C, washing hands with antimicrobial soap for 20 seconds. Option D, following a strict order of draw sequence. The correct answer is option B, utilizing a sharps container with a wide, drop-in opening and safety needle shields. Sharps containers with safe openings and safety needle shields are engineering controls because they isolate or remove the hazard by design. These devices reduce needle stick risk during and after collection. Gloves and training are important but do not physically engineer the hazard away. Question 67. When performing a newborn screening, PKU, collection card, how must the blood be applied to the filter paper? Option A, layered drop upon drop until the circle is saturated. Option B, applied to both sides of the paper simultaneously. Option C, brought into direct contact with a single large drop to fill the circle completely. Option D, smeared across the surface using a plastic capillary tube. The correct answer is option C, brought into direct contact with a single large drop to fill the circle completely. Newborn screening filter paper should be filled by touching the paper to a large hanging drop of blood until the circle saturates. The blood should soak through evenly from one side without layering multiple drops. Smearing, scraping, or applying blood to both sides can invalidate the specimen. Question 68. What is the primary clinical reason for wiping away the first drop of blood during a capillary skin puncture? Option A, to eliminate surface bacterial contamination from the skin. Option B, to remove tissue fluid contamination that can dilute the sample and cause microclots. Option C, to prevent the blood from clotting too quickly in the microcollection tube. Option D, to ensure that the blood flow is adequate for collection. The correct answer is option B, to remove tissue fluid contamination that can dilute the sample and cause microclots. The first drop from a capillary puncture is wiped away because it can contain tissue fluid and activated clotting material. Removing it improves sample concentration and reduces microclot risk. Excessive squeezing after the puncture can reintroduce tissue fluid contamination. Question 69. What is the proper location for a capillary puncture on an infant's foot? Option A, the center of the plantar surface near the arch. Option B, the medial or lateral borders of the plantar surface of the heel. Option C, the tip of the great toe. Option D, the posterior curvature of the heel bone. The correct answer is option B, the medial or lateral borders of the plantar surface of the heel. Infant heel punctures are performed on the medial or lateral borders of the plantar heel. These areas avoid the calcaneus and reduce the chance of bone injury. The arch, great toe, and posterior heel are unsafe sites for routine infant skin puncture. Question 70. Which of the following options defines the proper site for an adult capillary puncture? Option A, the thumb or index finger of the dominant hand. Option B, the lateral or medial plantar surface of the heel. Option C, the palmar surface of the distal segment of the middle or ring finger. Option D, the side of the pinky finger near the cuticle. The correct answer is option C, the palmar surface of the distal segment of the middle or ring finger. Adult capillary puncture is performed on the palmar surface of the distal segment of the middle or ring finger. These sites provide good blood flow and avoid bone, tendons, and heavily used thumb or index finger surfaces. The pinky and areas near the nail bed are more prone to injury or poor flow. Question 71. What clinical term describes the liquid portion of a blood specimen that has been allowed to clot completely before centrifugation? Option A, plasma. Option B, serum. Option C, whole blood. Option D, buffy coat. The correct answer is option B, serum. Serum is the liquid portion of blood after the sample has clotted completely and been centrifuged. It lacks fibrinogen because fibrin clot formation has already occurred. Plasma is obtained from anticoagulated blood. Question 72. Which of the following is a primary duty of a phlebotomist regarding quality assurance? Option A, interpreting abnormal lab results for patients. Option B, ensuring specimen tubes are collected, labeled, and transported correctly. Option C, changing medication doses based on therapeutic levels. Option D, performing complex tissue biopsies in the operating room. The correct answer is option B, ensuring specimen tubes are collected, labeled, and transported correctly. Phlebotomy quality assurance focuses on collecting, labeling, handling, and transporting specimens properly. These pre-analytical steps have a major impact on result accuracy. Interpreting results, changing medication doses, or performing biopsies is outside the phlebotomist's usual role. Question 73. What type of communication technique involves nodding, maintaining eye contact, and repeating back statements to ensure clear understanding? Option A, passive communication. Option B, aggressive communication. Option C, active listening. Option D, defensive communication. The correct answer is option C, active listening. Active listening uses eye contact, nodding, attentive posture, and restating information to confirm understanding. It helps patients feel heard and reduces miscommunication during care. Passive, aggressive, or defensive communication does not reliably verify understanding. Question 74. What type of mask is required when entering a room designated for droplet precautions? Option A certified N95 respirator mask. Option B, a standard fluid-resistant surgical mask. Option C, a cloth face covering or scarf. Option D, no mask is required if you stay 2 feet away from the bed. The correct answer is option B, a standard fluid-resistant surgical mask. Droplet precautions require a standard fluid-resistant surgical mask when entering the patient's room or working close to the patient. The mask blocks larger respiratory droplets from reaching mucous membranes. N95 respirators are used for airborne precautions, not routine droplet isolation. Question 75. What type of consent is given when a patient extends their arm and rolls up their sleeve for a blood draw? Option A, informed consent. Option B, expressed consent. Option C, implied consent. Option D, statutory consent. The correct answer is option C, implied consent. Implied consent occurs when a patient cooperates through behavior rather than signing or verbally stating agreement. Extending the arm after the procedure is explained shows permission for a routine blood draw. Written informed consent is used for procedures with greater risk or more formal requirements. Question 76. What should a phlebotomist do if they note a discrepancy between the patient's verbal name and the name on the pre-printed lab requisition? Option A, change the requisition manually using a pen to match the verbal statement. Option B, contact the supervisor or ordering nurse to resolve the issue before drawing blood. Option C, draw the blood and sort out the labeling discrepancy later in the lab. Option D, assume the patient knows their own name and print a new label on the spot. The correct answer is option B. Contact the supervisor or ordering nurse to resolve the issue before drawing blood. Any mismatch between the patient's statement and the requisition must be resolved before collection. Proceeding with unresolved identity information can create a wrong patient specimen and unsafe results. The phlebotomist should involve the supervisor, nurse, or ordering provider according to policy. Question 77. A patient under contact precautions requires a blood draw. Which of the following personal protective equipment, PPE, must the phlebotomist don before entering the room? Option A, N95 respirator and gloves. Option B, gown and gloves. Option C, surgical mask and face shield. Option D, gown, mask, and goggles. The correct answer is option B, gown and gloves. Contact precautions require barrier protection against organisms spread by direct touch or contaminated surfaces. Gown and gloves protect clothing and hands before entering the room and should be removed according to facility procedure before exit. Respirators are reserved for airborne hazards, while masks and eye protection are added when splash or droplet exposure is expected. Question 78. What should a phlebotomist use to cleanse the skin surface prior to collecting a blood alcohol specimen for legal purposes? Option A, 70% isopropyl alcohol prep pads. Option B, povidone iodine or chlorhexidine gluconate or non-alcoholic soap and water. Option C, tincture of iodine solution. Option D, concentrated hydrogen peroxide spray. The correct answer is option B, povidone iodine or chlorhexidine gluconate or non-alcoholic soap and water. Blood alcohol specimens for legal testing should be collected using a non-alcohol skin cleanser such as povidone iodine, chlorhexidine, or soap and water. This avoids any appearance that alcohol from the prep contaminated the specimen. Routine isopropyl alcohol pads are avoided for forensic alcohol collections. Question 79. What should a phlebotomist do if they note a discrepancy between the patient's spelling of their last name on their wristband versus the lab order? Option A, correct the spelling on the band using a waterproof marker. Option B, proceed with the draw as long as the first name and birth date match perfectly. Option C, hold the procedure and contact the nursing staff or registration to correct the identification bands before drawing blood. Option D, assume the lab order has a typographical error and proceed with the draw. The correct answer is option C, hold the procedure and contact the nursing staff or registration to correct the identification bands before drawing blood. A spelling mismatch between the wristband and lab order is an identification discrepancy. Collection should be held until nursing staff or registration resolves and documents the accurate identifiers. Drawing first and fixing labels later risks a wrong patient specimen. Question 80. Which of the following tubes is typically selected for a zinc, copper, or trace element determination? Option of royal blue top tube. Option B, lavender top tube. Option C, light blue top tube. Option D, grey top tube. The correct answer is option A, royal blue top tube. Royal blue top tubes are designed for trace element testing such as zinc and copper. They minimize contamination from tube components that could falsely elevate trace metal results. Routine additive tubes are not manufactured to the same low contamination standards. Question 81. What is the minimum amount of time a serum separator tube, SSD, must stand in a vertical rack to clot completely before centrifugation? Option A, 5 minutes. Option B, 10 minutes. Option C, 30 minutes. Option D, 90 minutes. The correct answer is option C, 30 minutes. Serum separator tubes usually need about 30 minutes upright to clot fully before centrifugation. Spinning before clot completion can produce fibrin strands and interfere with serum separation. Waiting too little risks poor specimen quality, while excessive delay may affect some analytes. Question 82. Which of the following tubes should be collected first when performing a venipuncture draw using a multisample needle? Option A, light blue top, sodium citrate. Option B, blood culture bottles or yellow SPS tube. Option C, red top, serum. Option D, green top, heparin. The correct answer is option B, blood culture bottles or yellow SPS tube. Blood culture bottles or yellow SPS tubes are collected first in a multi-sample drawer. This protects the culture from additive carryover and supports sterile organism recovery. Coagulation and other additive tubes follow in the established order of draw. Question 83. Which of the following situations can cause a false elevation in a patient's serum ammonia level? Option A. Transporting the specimen to the laboratory on ice. Option B. Delaying the separation of cells from the plasma beyond 15 minutes at room temperature. Option C. Using a green top tube containing sodium heparin. Option D. Labeling the specimen tube at the patient's bedside. The correct answer is option B. Delaying the separation of cells from the plasma beyond 15 minutes at room temperature. Ammonia can rise falsely when cells remain in contact with plasma at room temperature. Prompt chilling, rapid transport, and timely separation help preserve the true value. Delays beyond recommended handling times are a major pre-analytical source of error. Question 84. What is the clinical term for an increase in the total number of circulating red blood cells? Option A. Anemia. Option B. Polycythemia. Option C. Leukemia. Option D. Thrombocytopenia. The correct answer is option B. Polycythemia. Polycythemia means an increased total number of circulating red blood cells or increased red cell mass. It can thicken blood and increase thrombotic risk depending on cause. Anemia is decreased red cell or hemoglobin concentration. Question 85. Which of the following tests evaluated the intrinsic pathway of the coagulation cascade and is used to monitor heparin therapy? Option A. Prothrombin time, patient. Option B. Activated partial thromboplastin time, APTT. Option C. Bleeding time test. Option D. Fibrin degradation products, FDP. The correct answer is option B. Activated partial thromboplastin time, APTT. APTT evaluates the intrinsic and common coagulation pathways and is used to monitor unfractionated heparin therapy. Heparin prolongs clotting activity measured by this test. Patient and INR are more associated with warfarin and the extrinsic pathway. Question 86. What is the standard ratio of blood to anticoagulant additive in a green top tube? Option A. 9:1. Option B. 4:1. Option C. There is no strict ratio as long as the tube contains enough anticoagulant to prevent clotting. Option D. 1:1. The correct answer is option C. There is no strict ratio as long as the tube contains enough anticoagulant to prevent clotting. Green top heparin tubes do not depend on a strict blood-to-additive ratio like light blue citrate tubes. The tube should still be filled adequately and mixed gently so enough heparin is present to prevent clotting. Coagulation citrate specimens are the classic ratio-sensitive collection. Question 87. What type of vessel carries oxygenated blood away from the heart to the systemic tissues? Option A. Artery. Option B. Vein. Option C. Capillary. Option D. Venule. The correct answer is option A. Artery. Systemic arteries carry oxygenated blood away from the heart to body tissues. They operate under higher pressure and have thicker walls than veins. The pulmonary artery is an exception because it carries deoxygenated blood to the lungs. Question 88. Which of the following tests requires a plain red top tube with no gel or additives? Option A. Complete blood count, CBC. Option B. Type and screen. Option C. Certain therapeutic drug levels that bind to gel barriers. Option D. Plasma glucose tracking. The correct answer is option C. Certain therapeutic drug levels that bind to gel barriers. Some therapeutic drugs can bind to separated gel or be affected by tube additives. A plain red top tube without gel is used when the test requires serum free from gel interference. CBC, blood bank testing, and plasma glucose monitoring use different specimen types. Question 89. When using a butterfly wind infusion set with a light blue top tube, why must a discard tube be drawn first? Option A. To clear any residual skin surface contaminants from the needle. Option B. To purge the air out of the butterfly tubing to ensure a proper fill volume. Option C. To activate the coagulation cascade prior to sample collection. Option D. To check if the vein has adequate pressure to fill a full tube. The correct answer is option B. To purge the air out of the butterfly tubing to ensure a proper fill volume. Butterfly tubing contains air that can reduce the fill volume of the first tube collected. A discard tube removes that air so a light blue citrate tube fills to the required level. The discard is not collected to clean the needle or activate clotting. Question 90. What is the function of the systemic circulatory system? Option A. Moving blood exclusively between the heart and the lungs for gas exchange. Option B. Routing oxygenated blood and nutrients from the heart out to the rest of the body tissue networks. Option C. Filtering liquid waste products through the nephron beds of the kidneys. Option D. Producing white blood cells within the flat bones of the axial skeleton. The correct answer is option B. Routing oxygenated blood and nutrients from the heart out to the rest of the body tissue networks. Systemic circulation delivers oxygenated blood and nutrients from the left side of the heart to body tissues. It also returns deoxygenated blood and metabolic waste products back toward the right side of the heart. Pulmonary circulation is limited to blood flow between the heart and lungs. Question 91. What type of urine specimen is ideal for routine screening and microscopic urinalysis? Option A. A 24-hour pooled collection. Option B. A random, first morning voided specimen. Option C. A multisample postprandial catch. Option D. A catheterized 12-hour collection sequence. The correct answer is option B. A random, first morning voided specimen. A first morning void is concentrated and useful for routine screening and microscopic urinalysis. It improves detection of cells, casts, proteins, and other substances that may be diluted later in the day. Timed collections and catheterized specimens are reserved for specific orders. Question 92. What is the primary reason for avoiding venipuncture on an arm with an active hematoma? Option A. The needle will cause the hematoma to spread to the opposite arm. Option B. The sample will be contaminated with hemolyzed, stagnant blood from outside the vein. Option C. The vacuum tubes will implode due to tissue density variations. Option D. It will cause immediate and permanent paralysis of the limb. The correct answer is option B. The sample will be contaminated with hemolyzed, stagnant blood from outside the vein. A hematoma contains pooled blood outside the vein that may be stagnant or hemolyzed. Drawing through or near it can contaminate the sample and worsen tissue injury. A different site, preferably the opposite arm, should be selected when possible. Question 93. What is the primary function of erythrocytes, red blood cells, in the human body? Option A. Defending the tissues against pathogenic bacterial invasions. Option B. Participating in the primary aggregation phase of blood clotting. Option C. Transporting oxygen from the lungs out to the body tissues and carbon dioxide back to the lungs. Option D. Producing circulating antibody proteins in response to vaccinations. The correct answer is option C. Transporting oxygen from the lungs out to the body tissues and carbon dioxide back to the lungs. Erythrocytes transport oxygen from the lungs to tissues and help return carbon dioxide to the lungs. Their hemoglobin content allows efficient gas binding and delivery. White cells defend against infection, and platelets support clot formation. Question 94. Which of the following conditions can cause a specimen's serum to appear bright red or pink after centrifugation? Option A. Lichemia. Option B. Icterus. Option C. Hemolysis. Option D. Hemoconcentration. The correct answer is option C. Hemolysis. Hemolysis releases hemoglobin from red cells and gives serum or plasma a red to pink color after centrifugation. It can also falsely alter potassium, LDH, ASD, and other analytes. Lichemia appears milky, and icterus appears yellow to amber. Question 95. What type of isolation room requires the air pressure to be lower than the surrounding hallway air pressure? Option A. Negative pressure isolation room, airborne precautions. Option B. Positive pressure isolation room, protective isolation. Option C. Standard contact isolation room. Option D. Droplet precaution room. The correct answer is option A. Negative pressure isolation room, airborne precautions. Airborne isolation uses negative room pressure so contaminated air flows into the room rather than out to the hallway. This helps contain airborne pathogens such as tuberculosis, measles, or varicella. Protective isolation for immunocompromised patients often uses positive pressure instead. Question 96. Which of the following tubes contains an additive that prevents clotting by activating antithrombins? Option A, light blue top, sodium citrate. Option B, green top, heparin. Option C, lavender top, EDTA. Option D, gray top, potassium oxalate. The correct answer is option B, green top, heparin. Heparin prevents clotting by activating antithrombin, which inhibits thrombin and other clotting factors. Green top tubes use this mechanism for plasma chemistry and selected special tests. EDTA and citrate work by binding calcium rather than activating antithrombin. Question 97. Which of the following practices is critical to perform when collecting a specimen for a cold agglutinin test? Option A, keep the collection tube pre-warmed to 37 degrees Celsius before and during collection. Option B, chill the tube in an ice slurry immediately after drawing. Option C, protect the specimen from light by wrapping it in heavy foil. Option D, centrifuge the tube immediately within 2 minutes of collection. The correct answer is option A, keep the collection tube pre-warmed to 37 degrees Celsius before and during collection. Cold agglutinin specimens must be collected and kept warm at about 37 degrees Celsius. Cooling can cause antibody-mediated red cell agglutination before testing and distort results. Pre-warmed tubes and warm transport preserve the specimen condition needed by the laboratory. Question 98. Which of the following parameters must be strictly managed when collecting an arterial blood gas (ABG) sample? Option A, protecting the syringe from exposure to direct light sources. Option B, ensuring the sample is analyzed within a strict time frame and transported according to facility requirements. Option C, inverting the syringe 20 times to mix the clot activator. Option D, using a gray top tube to transport the arterial blood. The correct answer is option B, ensuring the sample is analyzed within a strict time frame and transported according to facility requirements. ABG specimens are time-sensitive because blood gases and pH can change after collection. The sample must be transported and analyzed promptly according to facility requirements. Delays, air bubbles, or improper temperature handling can distort oxygen, carbon dioxide, and pH values. Question 99. What type of specimen is obtained when a blood sample collected in a heparinized tube is centrifuged? Option A, serum. Option B, plasma. Option C, whole blood. Option D, fibrin clot. The correct answer is option B, plasma. Centrifuged blood collected in a heparin tube yields plasma because clotting was prevented. Plasma contains fibrinogen and other clotting factors. Serum requires the blood to clot before centrifugation. Question 100. Which of the following veins is located on the outer thumb side of the arm and is the third choice for venipuncture? Option A, cephalic vein. Option B, basilic vein. Option C, median cubital vein. Option D, brachial vein. The correct answer is option A, cephalic vein. The cephalic vein lies on the lateral, thumb side of the arm and is often a later choice for venipuncture. It may be more difficult to anchor and access than the median cubital vein. The basilic vein is medial and carries greater nerve and artery risk.